What psychiatric symptoms could be experienced from a patient who has high methylmalonic acid, normal homocysteine, normal B12 level, low B6?
High levels of methylmalonic acid, MMA, with normal homocysteine and vitamin B12 levels, but low vitamin B6, can potentially lead to various psychiatric symptoms. Here's a breakdown. 1. Methylmalonic acidemia. Elevated MMA usually suggests a condition called methylmalonic acidemia, which can have neurological and psychiatric manifestations. These can include irritability, lethargy, cognitive deficits, and in severe cases, psychosis. 2. Vitamin B6 deficiency. Low levels of vitamin B6, pyridoxine, are also significant. Vitamin B6 is crucial for the synthesis of neurotransmitters such as serotonin and dopamine. Deficiency might lead to symptoms like depression, anxiety, irritability, and possibly confusion. 3. Interplay of B vitamins. Vitamins B6, B12, and folate are all crucial for brain health and are interrelated in their metabolic pathways. Imbalances in one can affect the functioning of others, potentially leading to mood disturbances, cognitive impairment, and other psychiatric symptoms. It's important to approach this with a healthcare professional who can conduct a thorough evaluation and consider all possible factors contributing to these symptoms.
What is the best specialty of doctor that could interpret and look at the entire picture in this scenario? Could the symptoms from methylmalonic acidemia and B6 deficiency mimic PMDD?
Yes, the symptoms from methylmalonic acidemia and vitamin B6 deficiency could potentially mimic some aspects of premenstrual dysphoric disorder, PMDD. Here's how. 1. Mood changes. Both conditions can lead to mood disturbances such as irritability, depression, and anxiety, which are also key symptoms of PMDD. 2. Cognitive issues. Cognitive difficulties, like confusion or trouble focusing, seen in methylmalonic acidemia and B6 deficiency, can also occur in PMDD, though they are more commonly associated with the former conditions. 3. Overlap in symptoms. The overlap in symptoms like irritability and mood swings can make it challenging to differentiate between these metabolic issues and PMDD without thorough medical evaluation. However, it's crucial to note that PMDD is specifically related to the menstrual cycle, with symptoms occurring in the luteal phase and resolving after menstruation starts. This cyclical nature is a key differentiator from the symptoms caused by methylmalonic acidemia and B6 deficiency. Accurate diagnosis requires careful tracking of symptoms and their relation to the menstrual cycle, along with appropriate biochemical and nutritional assessments.
Does premenstrual exacerbation of methylmalonic acidemia exist?
There's no widely recognized condition, specifically termed premenstrual exacerbation of methylmalonic acidemia, in medical literature as of my last update. However, a few points are worth considering. 1. Hormonal fluctuations. The menstrual cycle involves significant hormonal fluctuations which can affect various bodily systems. It's conceivable that these hormonal changes might impact underlying conditions, including metabolic disorders. 2. Stress and metabolism. The premenstrual phase can be stressful for some women, and stress can influence metabolic processes. In conditions like methylmalonic acidemia, which involve metabolic pathways, this could theoretically lead to variations in symptom severity. 3. Individual variability. Each individual's response to hormonal changes can vary greatly. Some women with existing medical conditions, including metabolic disorders, might notice a change in symptoms correlating with their menstrual cycle. 4. Need for research. There is still a lot to understand about the interaction between menstrual cycle hormonal changes and metabolic disorders like methylmalonic acidemia. More research in this area could provide clearer insights. If someone with methylmalonic acidemia notices a pattern of symptom fluctuation with their menstrual cycle, it would be advisable to discuss this with a healthcare provider for a personalized assessment and management plan.